Hello, I'm Dr. Stuart Flanagan. I'm an NHS doctor who works in the media, and today I'm going to give you some medical advice. So we've got some tips on how to get rid of a cold sore fast. First of all, it's important to think about what causes a cold sore, and it's caused by a virus called the herpes simplex virus. It's an extremely common virus, and most of us come into contact with it at some point in our lives. Cold sore happens when the virus infects the little mucous membranes on the top of the lip, and it can often cause no symptoms initially, but it sits inside those tissues and can then travel towards the nerve sheath alongside and lie there completely dormant or inactive for many months or even years. When the virus does become active, then it travels down the nerve sheath and it can inflame the tissues around the lip. That can cause blistering, ulceration. Often the blisters can weep and it can be quite painful and uncomfortable. Usually it's all preceded by a tingling sensation, and then those symptoms start to come through and we see a typical cold sore developing on the mouth. Usually cold sore lasts for 3 to 4 days. Sometimes it can last a little bit longer, up to a week. During the course of the week, you may get tingling initially, then pain which intensifies, but eventually the cold sore will scab over and heal completely. A cold sore can often be triggered by a reduction in your immune system, and that's what causes the virus to become active and cause symptoms. And that can be, for example, a flu or a cold, or if you're getting other treatments like chemotherapy, for example, which can reduce your immune response. Some tips on how to manage a cold sore include definitely don't pick it or try and remove the scab. That will only make things worse, and it's possible you could spread it elsewhere around the mouth or even to your finger. Take some simple painkillers for the discomfort and irritation, and also you can look out for some anaesthetic gel which you can buy from over the counter, which will soothe the irritation and inflammation around the cold sore. If you want to try and stop the cold sore in its tracks, there are some good antiviral treatments which are based on the antiviral acyclovir. And these are often gels or creams which you can apply to the lip, and they're best applied in what's termed the prodromal phase, which is the tingling that you get before you get an outbreak of a sore. That's when they'll work best, and they'll try and prevent the full ulceration and blistering that you can get when a cold sore comes through. One other thing to bear in mind is that cold sores can be really infectious, especially when you've got a sore there. So it's important not to kiss anyone, not to contact anyone too closely, and also not to pick and scratch that area because you can auto-inoculate or cause a cold sore somewhere else on your own body. So those are some tips on how to get rid of a cold sore fast.